So in the 6 years that Doug Ford has been in power, we've actually seen the number of people in Ontario without a family doctor nearly double. There are over 1 million more people today that don't have a family doctor than did in 2018. And so when faced with that crisis, what I see from the announcement today is simply a Band-Aid solution. I mean, I imagine to myself someone with some sort of clinical health concern lining up at a pharmacy, talking to a pharmacist behind a counter with a line of people behind them, not really feeling comfortable doing that, not being able to get a physical examination, not having a longitudinal relationship with the healthcare provider. You know, that is the promise of primary care, and that is a promise that Doug Ford has been breaking over the past 6 years, and certainly a promise that he's not delivering upon today. And I have to imagine every time one of these announcements come out, who is ultimately benefiting? And I have a feeling that someone like Shoppers Drug Mart is actually standing to benefit a lot more from today's announcement than the patients of Ontario.
Right. And before I follow up on that, one of the things the government says is this will free up family doctors to treat patients with more complex needs. But this isn't a replacement for family doctors.
No, not at all. I mean, as I mentioned, the promise of primary care is having a family doctor that you have an ongoing relationship with, that you know really well, that can address all of your needs. I mean, when they announced the list of potential common ailments, they were including things like headaches. Now look, a headache that you have at home that you take a tablet of Tylenol for, that can be a minor thing. The kind of headache that you go to see your family doctor about is not a minor ailment. It needs a history, a physical examination, a neurological examination, sometimes some sort of advanced imaging. You're not going to get that from a pharmacist. And if it's simple enough that it can be addressed with a Tylenol or an Advil, that's not something that you need. That's not the kind of thing that people are going to their family doctor about, and they're not getting what they need.